I'm Dr. Kelly Anderson. I'm one of the new OBGYNs at Myrtue Medical Center. I grew up in a small town right outside of Charlotte, North Carolina. Loved the Carolinas, loved growing up in a small town. I went to undergrad near Charlotte, North Carolina. Then went to Charleston, South Carolina, where I did some grad school. And that's actually where I met my husband, Michael. We lived in Charleston for about 6 years. I went to med school in upstate South Carolina at Edward Via College of Osteopathic Medicine. And from there, I got matched into a obstetrics and gynecology residency program right outside of Detroit, Michigan. So my husband and I decided to start a family in my 4th year of residency, and we now have a 1-year-old son named Luke. And we were looking for a place where he would enjoy growing up. I enjoyed growing up in a small town, and my husband did as well. So we hooked up with a recruiter, and they said, well, I have this place in Harlan, Iowa. And so we came out here for an interview and absolutely fell in love. We loved the small town feel. We just felt like it was family here. We liked the landscape of Iowa and the people, and here we are. Whether it's playing with my son's trucks on the living room floor or going outside and being adventurous. We like to do outside activities. We like to ride 4-wheelers and take long walks. We like to go kayaking when the weather's nice also. So I really value my family time and enjoy that as good quality time. I do like to cook also, so don't be surprised if I bring in baked goods to work every now and then. I always knew I wanted to be a physician. That's one of those things your kindergarten teacher asks you, what do you want to be when you grow up? And you say, doctor. And that just kind of stuck with me through school. So I knew I wanted to go to med school, so once I got there, I wasn't quite sure the field of medicine that I wanted to go into. Second year, we were in this simulator lab, and we had this life-size dummy, for lack of better words, that simulated giving birth. So, here I was telling this simulator to push and push and push, and finally the baby came out, and I held it up, and I said, I think it looks like Kelly. But no, I really enjoyed learning about maternal health and then health for mom and baby at that time. So the more experiences I had in med school that dealt with both moms and babies, I really enjoyed. So that kind of solidified my desire to do obstetrics and gynecology.